FAVMI presents Unfolding Mental Illness, hosted by Saraswati Suresh.
Hello, everyone, and welcome to our podcast series on Unfolding Mental Illness by FAVMI, Family's Voice on Mental Illness. We are also the Western Zone of Families Alliance on Mental Illness, Face Me India, founded by Dr. Nirmala Srinivasan. Through our episodes, we strive to educate and support families about mental health, providing them with tools, resources, and insights from both professionals and those with lived experience. If you're a family seeking guidance, understanding, and a community that truly cares, we invite you to subscribe to our YouTube channel at favme.in and our Instagram post at favme.in. I am Saraswati Suresh, your host, and my co-host is Dr. Sachin Ganorkar. Our episode today is Understanding the Journey of Rehab, Crisis to Recovery. And we will talk about what happens when a mental health crisis occurs, how families respond, what the early days of rehabilitation looks like, and how the recovery slowly begins. We will also touch on the emotional challenges which families face, the need for better and more holistic rehab centers in India, and how families and communities can support in lasting recovery. And to have this conversation on this journey from crisis to healing, one filled with courage, compassion, and hope, we are honored to have Dr. Amar Shinde, a consultant psychiatrist and founder of the Jagruti Rehabilitation Centre, with us today. A postgraduate from the prestigious BJ Medical College, Pune, trained under Padma Shri Dr. Mohan Agashe and the late Dr. Alka Pawar, Dr. Shinde has dedicated his career to advanced psychiatric care and rehabilitation. He is a member of the Executive Council of the Indian Psychiatric Society and the former president of the IPS Pune branch. Through his initiative, Mano Jagruti, he has worked extensively to bring mental health awareness and free treatment to rural and some populations. Under his leadership, Jagruti Rehabilitation Centre, it has grown into one of the largest neuropsychological care networks in the country, offering comprehensive treatment for psychiatric, neuropsychiatric, and addiction-related conditions. Welcome, Dr. Shinde. We're absolutely honored, I and Dr. Sachin, to have this conversation with you, sir.
Thank you. Thank you so much for the kind introduction.
Yeah. So first, we'll start to the first understanding of the question is, what is crisis in the terms of rehabilitation, and what should families actually do during such a crisis situation?
Yeah. This is the most important question, I think. In mental health, what happens is we are finding patients who are in critical conditions or violent, aggression, and sometimes they are there is a risk to themselves as well as families or society also. But why crisis comes? I think there is a lot of problems because people are coming late to the psychiatric hospitals or centers. Many times what happens, psychiatry condition is first time in their life. So they don't know about the what psychiatric problems are there. Sometimes there may be acute psychotic like suspicious or depression, suicidal thoughts. Usually, I would suggest people they should come earlier because they are coming late. If there is a change in behavior, I think that is a crisis. I can give one example like if anybody is having good engineer or he's doing IIT or MBA, and if sudden behavioral changes, he stop going to classes or sometimes he's not eating properly, sometimes getting irritable easily, I think we should seek help at that point of time. Otherwise, in crisis, it is very difficult to bring patient to the psychiatric hospital or rehabilitation center, difficult to control the patient. These are the main important problems in crisis of mental health. Yes.
Why do you think families then actually delay? I mean, you mentioned that, they don't come immediately. I mean, honestly speaking, it's, when a mental health happens, families don't understand. I mean, I have gone through this as a mother. I really never even understood the word psychosis or
Process.
schizophrenia. They were all. I mean, you've heard about it, but what is delusion, what's hallucinations. We don't understand when it actually happens. We think it's a passing phase or things like that. So when you say delay, how should we avoid that then?
Yeah, as I earlier said, कि if there is any behavioral change in any person, we have to immediately seek some help. At least we have to understand कि इसको क्या हो रहा है.
Hmm.
बहुत बार there is a lot of stigma in society. अगर मेरे घर में साइकेट्रिक प्रॉब्लम है तो किसी को भी लगता है कि इट इज नॉट पॉसिबल. हाउ इट इज पॉसिबल? देयर इज नो स्ट्रेस, एवरीथिंग इज गोइंग गुड, हम अच्छे फैमिली से पढ़े लिखे हैं. इस वजह से क्या होता है, स्टिग्मा की वजह से दे आर कमिंग लेट to the psychiatrist or psychologist or any help. We can give examples like children. If any children at 8th class, 9th class, or small younger children, if they leave school suddenly or they stop going to the school, I think that is emergency for us. And sometimes this emergency we don't understand. So we need to understand ki what are the problems about psychiatry. Like psychiatry is a big thing. ये खाली साइकोसिस, स्किज़ोफ्रेनिया या ठराविक मेंटल इलनेस का नहीं है. इसमें बहुत सारा इट इज अ कॉम्प्रिहेंसिव प्रॉब्लम. लाइक जिसमें से छोटा सा डिप्रेशन से पकड़ के लंबा शक या वायलेंट बिहेवियर या कभी कभी एडिक्शंस, कैनाबिस, ये सब कुछ चीजें इसमें होती है. तो अपने को आइडेंटिफाई करना जरूरी है. और ये स्टिग्मा साइकेट्री रिलेटेड वो निकालना बहुत इम्पोर्टेंट है.
Very
यस.
true, because जब तक हम लोग बात नहीं करेंगे, I don't think we will be able to remove stigma out of, let people talk more about it and bring more awareness about it. And that's what we are also trying to do, sir.
Yes, absolutely. Mm.
So I completely agree with you. So the first step is, instead of reaching into the extreme of crisis, it begins right at the point when we actually identify and seek help. So what
Yes.
happens when we first 72 hours when we admit our loved one in a rehab center?
Yeah, absolutely. That is a big question for everyone. सभी को लगता है कि जब एडमिट करेंगे तो आप क्या करेंगे, उसको कैसे ट्रीटमेंट करेंगे, हाउ टू ट्रीट. यानी साइकेट्रिक कंडीशन अलग अलग रहते हैं. तो फर्स्ट कंडीशन अपना क्या आएगी? फर्स्ट इज द सेफ्टी, safety of the person, and second is safety of the caregiver. These two things are primary thing. If patient is getting irritable, violent, or sometimes we can say some geriatric patients, older patients like dementia, they are getting violent. Everybody says कि अरे उनको कुछ तो mental problem हो गया है, but it is not like that. डिमेंशिया से क्या होता है कि उनको कंफ्यूजन होता है, दे आर डिसओरिएंटेड एंड दे आर वरीड अबाउट द पास्ट, दे आर वरीड अबाउट द करंट सिचुएशन एंड दे आर इनसिक्योर. सो ऐसे कंडीशन में जो पहला अपना 2 से 3 दिन का जो प्रॉब्लम ट्रीटमेंट रहता है, जैसे 48 to 72 आवर्स में, इसमें इंपॉर्टेंट रहता है कि स्टेबलाइजेशन, उनके सिस्टम सिम्टम्स स्टेबलाइज होना जरूरी है. जिसमें सबसे पहला रहता है स्लिप स्टेबलाइज होना, उनका एग्रेशन कम होना, और वो एटलीस्ट दे शुड स्टार्ट टॉकिंग टू अस, बातचीत करना, कम्युनिकेशन करना. ये अपने लिए इंपॉर्टेंट चीज रहता है. So that is the first target of stabilization in first 3 days. Yes.
So then that you actually start the treatment program.
Yeah, absolutely. Now, then we will understand the patient.
Yeah.
Yeah.
Sir, it's, for families, when you say a rehab center, okay,
Mm.
it has a very different connotation.
Mm-hmm.
It's I mean, it's a very difficult decision to say that I'll put my loved one into a rehab center. There's a lot of emotional, baggage
Distress.
and distress for the family. And also, कि society क्या बोला, आपके बच्चे या, spouse or whatever, you have put in a rehab center for treatment. Then also, you also have these thoughts in your mind, कि, उसको बांध के रखेंगे, whatever you have seen in movies, and, all
Yes. Yes.
that is going on in your head. So what would your message be to families? It's not wrong to put in a rehab center, and why should a family take that initiative of doing it? What would be your message to them?
ये एब्सोल्युटली, जैसे हमने अभी देखा है कि स्टिग्मा बहुत है, स्टिग्मा के साथ फियर भी बहुत रहता है। बहुत बार हमने क्या देखा है कि फैमिलीज आर ओवर एक्सप्रेस्ड, उनके जो इमोशंस रहते हैं इतने इमोशंस रहते हैं कि दे आर नॉट अलाउिंग देयर चिल्ड्रन और देयर पेरेंट्स टू कीप इन द रिहैब सेंटर और टू एडमिट इन एनी फैसिलिटी। बट आई थिंक at the same point of time we should think of the practicality. If any engineer or if any doctor is having sudden psychotic or sudden behavioral changes, I think we should look after the main career is the most important thing. Their life is most important thing. These are the rational things that we need to understand. I think we need to have a lot of such podcasts so that people will understand कि what are the mental illness and how simple is it. अगर हमारा एक्सपीरियंस आप पूछेंगे तो सबसे इम्पोर्टेंट रिहैब में जो ये फियर रहता है कि उनको बांध के रखेंगे, या मूवी में सलमान खान जैसे वायलेंट हो जाता है बांध के रखते, सो 99% पेशेंट को हमें बांधने का जरूरत ही नहीं पड़ता। सिंपली उनको फैसिलिटी में हम अगर शिफ्ट भी करेंगे तो इमीडिएटली दे गेट काम डाउन। अगर हम देखेंगे तो सबसे बड़ा प्रॉब्लम उनका फैमिली मेंबर के साथ रहता है। बहुत बार उनके साथ अल्टरकेशन, झगड़ा, एंगर, और फैमिली मेंबर उनके पीछे पड़ते हैं, अरे खाओ, खाना खाओ, सो जाओ, गोली खाओ। सो ये जो फैमिली के साथ उनका रिलेशन है ना, वो बहुत प्रॉब्लमेटिक रहता है। और बहुत बार पेशेंट ऑल्सो गेट रिलीव्ड व्हेन दे गेट एडमिटेड इन द फैसिलिटी। सो हमारा पर्सनल एक्सपीरियंस है, उनको रिस्टेन करना, इवन इंजेक्शन देना, इसका भी रिक्वायरमेंट बहुत कम है। सो इट इज वेरी इजी टू गेट एडमिटेड। एडमिट होने के बाद उनको एक बार एक्सप्लेन करेंगे कि आप रिहैब सेंटर में यू आर इन सेफ प्लेस, तो उनका जो वायलेंस, एग्रेशन, ये सब कम होता है। सो फर्स्ट थेरेपी इज द टॉकिंग डाउन थेरेपी। उनसे बात करो, कम्युनिकेट करो, उनका विश्वास संपादन करो। अगर हमको अच्छा, दे स्टार्ट बिलीविंग अस, रैपो डेवलपमेंट इज आवर ट्रीटमेंट। द फर्स्ट ट्रीटमेंट इज रैपो डेवलपमेंट, दे शुड बिलीव ऑन अस। once they start believing us, they will listen us properly. So ये जो लोगों में, समाज में लोगों को लगता है कि पेशेंट गेट वायलेंट, एग्रेसिव, ऐसा कुछ नहीं होता। दे गेट एब्सोल्युटली काम डाउन, क्योंकि बाहर के लोगों के साथ उनका रिलेशन बहुत अच्छा रहता है, बिकॉज दे आर इंटेलिजेंट पीपल। तो ये सबसे इम्पोर्टेंट बात है, लोगों से ख्याल से निकालना चाहिए कि रिहैब में या मेंटल साइकियाट्रिक फैसिलिटी में बहुत बड़ा कुछ होता है। यस।
And it is the place where you are actually getting treatment to get better.
या
It is not कि उनको हमने अकेला छोड़ दिया. It is actually a place where I'm getting better. It's like something like, I would say, if I have to take a surgery, I go to a hospital to get it done. It's a very similar process, I would think so.
एब्सोल्युटली।
Yeah. So another thing as a family is what I come across is that a lot of families ask us these questions, and that's why I'm asking you this question is, why are there not such good rehab centers in India, which looks it from a very holistic approach, uh, I mean, we keep looking out for, and then there are reviews ki ye acha nahi hai, wo acha nahi hai, and cost. Another thing, not everybody is being able to afford the kind of uh, I do understand that if I want a good rehab, I should be ready to pay, but even then it becomes very challenging for families. So how can we have, I mean, you have running so many centers in India. What is you would say that, how can we go about doing it, sir?
Yes, I was working in mental hospital as well initially. So my career started. I started in the BJ Medical College. Then I got. I was MPSC pass. Then I got a medical officer post in mental hospital, Yeroda Mental Hospital. So after looking at that place, usually the government facilities in current scenario also, the facilities, the caregivers, the system is not looking that that is we are not confident about that facility. Then we have seen a lot of rehab center who are having very higher cost. If we compare, I have visited all over world. Every city, whenever I go, I visit a mental health facility or elder care facility. That is my routine in my tour, because we need to understand the situation, how they treat the patient, and usually, if we see, their charges are too much. They are, if we see in Indian currency, they are almost 4 5 lakhs per month, more than that. And in government facilities, there are usually there are problems in the public education, and a lot of crowding is also there. So the facility is not that up to the mark. So what to do about? Then I thought ki we should develop a facility all over India, so that we can reach to the masses, and that should be affordable, not high cost and not low cost. So we have a different range. We are charging from 30,000 per month to up to 2 lakhs per month. So we are having different types, supplies to different class of the society. So this category we have started, and we are getting so much response, because that is totally all over India. There are no quality, even small setups, they are charging too much. Or some setups, like they are run by NGOs, and sometimes the setups are not up to the mark. So we are providing quality care with affordable charges. We charge from 30,000 onwards.
And you follow a very holistic approach, like
Absolutely. Our approach to the patient is totally different. Our thinking is, any psychiatric or psychological patient, they should have some meaningful life. At least some improvement in their life is required. So if you see, we are having medicines for that. If we see patient of schizophrenia, what happens? Ki there are medicines. And we are finding that some medicines, some people are using very high doses of medications. Sometimes medicines is like double-edged sword. They are beneficial as well as, and they are creating problems, side effect, slowness, dullness, slurring. If we see the patient, they are like, their life is compromised with the medicines as well. So illness as well as medicine, both things are having the problem. Similar with geriatric population, if we see any prescription, there are lots of medications written in that medicines, and sometimes they are having side effects like falls, sudden death, accidents. Their life and their morbidity is too much after the medication as well. So our treatment is holistic treatment. So we are, our medicine use is very much less. If we come and see our patients, they are very fresh, because there are no side effects of the medicines. Usually we try to reduce the side effect to minimal. Even in dementia patients or any elderly patient, we are not using antipsychotics at all, because antipsychotic create a lot of problem in that patients. So meaningful life is the most important thing, so that the person will be happy and their family will be also very happy. So we are doing a lot of studies on this also. One study is going on for the withdrawal treatment in our centers. So we have created some protocol for medicines, so that there should not be withdrawals or very minimal withdrawals in case of addictions. So similar, we are having various protocols of medications. So for acute psychiatry, what type of medicines? Chronic psychiatry, what type of medicines? And because of all these protocols, all these experiments, what we are doing on a holistic basis, they are having wonderful life in our center as well as outside also.
fantastic, doctor. Lovely to hear this,
Thank you.
because that's the biggest challenge which families are facing. And
Yes.
and there's nothing wrong when one is trying to send their loved one out over there. And I agree with you. The meaningful life is what should be the ultimate goal of every family. Absolutely. I now hand it over to Dr. Sachin to take it forward, sir. Yeah.
Thank you very much.
Thank you, Dr. Shinde. Thank you, Saraswati,
Thank
for
you.
this very important topic. Thank you, sir, for your time. So to continue with what Saraswati asked, what could be the components of a journey? Like suppose if I'm at home and a crisis occurs, uh, what is the kind of a checklist I'm to have? So one is a clinical part, which there could be a known patient, or there could be somebody who had a new crisis. And we also have the mental health law. So what should a family carry if they have to come to your center? Suppose somebody calls and says that we have to come to your center. Then what happens at your center? And the question is then, what is the journey? What is the step down journey and social integration after rehabilitation? So if you could please enumerate. And also one question which is very common is about women, because as Saraswati said that there are misconceptions about center. So how are women patients handled in a rehab center?
Yeah. So the most important thing is admission in the rehab center. Sometimes, because of new mental health law and lots of awareness currently in the society, the families are also worried how to get the patient admitted, and particularly if the person is not willing, what to do. So that is another questions. So sometimes what happens ki many times they are not taking responsibility to get him admitted, and so the treatment pattern is delayed. So I think every family should know that mental health law is reverse. That is safe for us. Mental health law. There are many conditions in which it is very much safety for us, because any psychiatrist will admit only if patient is having problem. So if you take the patient to the mental health facility, simple under section 89 we can admit for 30 days. It is not a big problem. So I think the mental health law, there is a fear of mental health law. That fear should go. Everybody should get awareness. Okay? It is not like that. Okay, we cannot treat the patient. We can treat the patient for a small period of time. 30 days is not too much. Or even we can have less than 30 days. So it is not required. Okay? Every patient is admitted is longer or chronic admission. It is not like that. We can admit for few days as well, because 50% of psychological problems are very short lived. So if we treat the crisis, patient can get immediately within 10-15 days also patient can be out and patient can live comfortably. So other 50% patient who are very difficult or having psychosis or any problem, so for that we can have that assisted admissions, or we can have section 89, 90. These sections are there, and these are also helpful to the family as well as to the patients, because in rehabilitation what we do, we are having in rehabilitation center, usually we divide the treatment part into two parts. First part is the active part, that is a treatment part, and second part is a rehabilitation part. After the improvement in the symptoms, if patient improves, their psychosis goes down, their depressive symptoms goes down, then the second part usually start, in which the main important thing is insight oriented psychotherapy. And in this part, we have patient oriented psychotherapy, then we will have family sessions, so that family would understand what are the conditions and how to go about in future. Then patient will also understand about the medication part. So after that, when the discharge process comes, so our plan is if the patient is compliant or not, if patient will take medicines or not, and accordingly we are having different plans. Like sometimes we are having depot injections who are not willing, 100% willing, and there are various stages of insight, we can say. Some patients are having 100% insights. They say, doctor, we know our illness. I am having these hallucinations and I should get out of it. So such patients are very good. They perform as good as a normal person in the society. So why not to give a good treatment for the person? And sometimes because of this fear, they don't. People are not taking the patients or clients to the centers, and the treatment part is delayed. That is the most important thing. So once they start getting good insight, or sometimes they are having partial insight, they understand if doctor says I will take the medicines, or if family says they take the medicines, then medicines part will go well. Now the first, after the stabilizing first phase, then understanding the illness, then stabilizing the total illness part, the next level usually comes like rehabilitation in working or their social life, their communication, their family life. So everything we have to look after that. Means any one patient we have to look after all the angles, not necessarily only illness. Illness is a very small part. But other impairment like social impairment is there, work impairment is there, marriage impairment is there. So many things are there. So I think the proper rehabilitation, many times they go out and they comfortably live their life, and the families are also getting satisfied. Yes, you are.
Yeah,
Can you
yeah,
unmute
thank you.
yourself, madam?
Yeah,
Hmm.
thank you, sir. No, I can see. So, is there a step down journey like after rehab happens? We hear of halfway homes. We
Yes.
hear of recovery wards. So, how does one step down from a rehab to the normal society? Is there a direct route, or one should go through a normal, go to a halfway home and then come back, reintegrate back into the society?
Yeah. After the initial acute treatment, or we can say some aggressive treatment, patient get back to stabilize. So usually in rehabilitation for psychosis or any big mental illness, we advise 3 months usually admissions. After 90 days, if they go out in the society, the first and primary is the stabilization at home. So our target is that patient should be comfortable at home. That is initial targets. So sometimes families are worried about their future. They are press them. They can get that they can get altercations. They are not working properly. Even though educated, they are not going to the colleges, schools, or work. So we have to explain the family. So in step down measures, usually we advise family that at least the person should get settled in the society. That is the first target in the family and society. After that, we can start some vocational activities, and that activities we can have a smaller activities initially, and that goes on increasing to the level of patient, because every patient is almost intelligent. They are intelligent, highly qualified people, but they are unable to do small activities also. So we have to target the small activity, the basic routine, and then scheduling and then planning, and we can have a goal, small goal we can keep in the this system. The 6 month our goal will be that, next 12 months the goal will be that. So many out of 100, around 50 to 60% patient achieve the goals comfortably. The some patients are having difficulties that we have to revise the goals. Yes, sir.
Thank you, sir. So, to come to the question, what does real recovery look like?
Yeah. So, in my, I have seen a lot of patients since 2008. I'm practicing. So, in this, we are understanding around 100 schizophrenia patient. If we see, around 30% of schizophrenia patient live absolutely normal life. So, our goals are education, working, and marriage. These are the three comfortable marriage or social goals. They achieve these three goals comfortably. Next 30% patients achieve this goal, but sometimes there are difficulties. We have to challenge the patient accordingly. So around 60% live comfortably. Next 30% there is impairment in social impairment is there, work impairment is there, but they are comfortable at home. So if we see around 100% patients, 10 patients are very difficult. So 10% patients sometimes may need long-term rehabilitation or institutionalization. They may need support. So under protective environment, they are very much comfortable. And in that 100, if we see 10% patient, only 1% of patients are very aggressive. So I think this 10% of patients who need require long-term institutional, we have to think. Sometimes families are worried how to go about their future. They are worried about how can they handle their finances and everything. So we have to look after. This is not a particular illness like open and shut. There are different scales. Every person we should have personalized care and treatment plan for every patient.
Thank
Yes.
you, sir. So, do you see, with all of us our families and Saraswati and me being a part of the system, do you see like a bridge coming between rehab centers and daycare centers where people actually can learn these skills which you have mentioned? Maybe actually get better, and because sometimes family don't have the support systems at home and they keep struggling with this over a period of
Absolutely.
time. So, do you think a bridge could be built between a short-term rehab stay and where one goes and actually picks up these skills in a daycare center?
Yeah, absolutely. That is the current need, I think. So what happens ki previously 10, 15 years back, the majority part was the treating the patient. That was the major part. Now we have to change the scenario in which person can go to the daycare center, so that the whole day facility should be there. So the because families are very much burdened because of the patient. Sometimes they are burdened because of the illness, the cost, they are not working, sometimes the symptoms. If we could have a lot of daycare centers and community integration, that is another part remaining, I think, in India particularly. Many times they are not accepted in the society. So community integration is also very much important. We have to develop such facility where they can have some daycare, they can have some activities. But many times what happens, ki these are the ideal conditions we see. Like currently I have one patient, yesterday I discussed with him. He's an engineer person. He's a BE. So at the age of 50 also, parents are older and they are worried about his future, what to do about. And they advise he should do something meaningful or some activity. Currently, he is almost symptom free. There are no proper psychotic symptoms. But sometimes these patients are having difficulty to adjust in the society. Like he's engineer. He feels I should work like engineer, but at the age he is not understanding, at the age of 50, it is very difficult to get jobs according to engineer. We have given him small work, but small work he is not willing to do. So that is another question for them, because they are intelligent and they feel why I should do. One another doctor is also admitted. I told ki you have to take rounds, just take BP, take care of the olders. No, no, I will not do that. That is another problem for handling this patient. So we have to go through this. Practicality is also important, and individual person is also important. So without symptoms also, there are some symptoms, like they are very rigid, they are fixed in their mindset, they want to do something only, but they take medicines and symptoms are almost zero at that condition. Yes.
So with your experience in Yarwada, and now you have this of centers across India, stigma is a very important part. So you have seen that people keep languishing at the health centers, and there is a lot of civil society awareness about stigma that they should get back to the society. So what are your opinions? What are your thoughts of how this could be handled? Can there be a way in which people who have already recovered, and there are like we are families, but there are families whom they cannot go back to. So this aspect of stigma, this aspect of that which question we asked earlier, that what is recovery? Can a person contribute back to the society? What would be your thoughts on this?
Yes. For every patient, I think in schizophrenia or major mental illness, if we see, there are chances of good recovery, but some patients are having some difficulties. So, in this case, what happens? The sigma, and initially I have seen, initially when I was practicing, I started at 2007 the setup, and I got admission in psychiatry 2004. 2004 to 2007 was education, and then 2007 8 I started practice. So back then there was too much stigma about this. Now people are coming up, like families like you and all people, they are coming up, they are talking openly, they are talking openly about the children, their colleagues, their families, their brothers, sisters, how to go about. So I think the stigma is slowly going down, and that is the role of all these civil societies, all these awareness programs continuously throughout India. It is going on. So I think the stigma about schizophrenia, stigma about the rehab, stigma about their employment also, it is going down. So for employment, we should have, and the government is also doing well. Like disability certificates are also we are getting for these patients, so they can easily get some jobs, some small jobs also they can do. But in disability also there are problems. So currently there are temporary disability certificates. Even if it's diagnosis of schizophrenia, there is sometimes they give like 5 years. And temporary, if there is temporary disability, they cannot get job. It's another problem. So I think we have to come together, everybody, all government agencies and we all civil societies, doctors, rehab centers, and we have to formulate something for them, so that they can, every person will be treated like a separate and single valued individual, so that we can provide them a proper guidelines. Yes.
Thank you, sir. So just to take it further, can some support systems come up which also where a loved one can be at home and there could be some kind of support which happens maybe from a rehab center or a daycare center, and they live with families more comfortably. Because I think families want their people to stay with them and also maybe function in some way in life, and also get that kind of a community support across in our society.
Yeah, absolutely. The every family is currently every person is valued. So even they are having some psychological issues or worrying, everybody, all family members are worried for their loved ones. So I have been talking to various family members. Even I have talking to the Schizophrenia Awareness Society. They are doing well in the daycare center in Pune. Also, there is a civil society in Delhi. Also, we are talking to them. They feel ki they want some facility, they good facility where their loved one can stay longer. They can do some work, and even family members wish they should come and stay with them with the affordable prices. The another issue is the sometimes the affordability is another issue. So they we had meeting last month. They wanted us to guide them in the developing such a facility, good facility where they can stay together, they can work a little bit, we can have some occupational units, there should be entertaining units, and all psychiatric or that patient can stay together, those family, and that should be affordable. So we, as a Jagruti, we are also thinking we should help. So we should create something for the people. So we have seen a lot of things, but the occupational therapy units we are not seeing across everywhere. And whether the occupational units like meetings only, whether the occupational units and other things, they are not proper. Like small units are there, like candle making, and sometimes if we there is an engineer patient, we tell them to do that thing. These are the basic things. I think we should come together. We should have something. We should have some idea so that many hands can work. The work should be like many hands can work. Sometimes there is only one machine and one person is working. So that is not very good for the patients. Yes. So I think if you have everybody in the who is listening this podcast, they have some good ideas. They can reach out us, and we can have some facility. I told them, okay, we should have some land initially. Then we can develop some proper living conditions, living setups for them. Yes.
Okay, thank you, sir. I think rehab actually, in an acute crisis, helps a family get a lot of clarity and structure,
Yeah.
so that in a short-term crisis they can go back. Can we also request you if you can just comment about addiction, which is happening in our society, like how, I mean, intoxication, and the mental health law also says that now addiction is also a mental health disorder. And now we also, as you also reading an elder care facility, that people are now left alone and there's nobody to look after them physically and mentally. So how could actually we address this in a constructive manner?
Yeah, absolutely. So addiction is one of the psychiatric condition we can say, and rightly in this mental health law, every the addiction part is included in mental health law. But in some northern state, they are still following the other facilities like social welfare departments and NDPS departments. Everything is there in northern India, like Punjab, Haryana, even UP has started the thing. So I think that is a wrong. They should also come under the mental health law. So there should be ease in the treatment. So what happens if anybody is intoxicated? Intoxicated patients, we have seen a lot of cases, like the Porsche case was there. The person was driving under intoxication. We should get them admitted. They need some help in mental health facilities. So intoxications, we can admit such patient forcefully under Section 89. It should be easy for everybody, even in the like medical facilities also. We are also worried to take such patient inside. So, according to mental health law, the government and everything should make aware everybody that there are certain provisions in law so that the addiction patient can get good treatment. So if this intoxication treated, another problem is withdrawal. So sometimes in withdrawals also they are very risky. They are in delirium. They are not understanding their conditions, what they are going through. Sometimes they are falls, accidents, injuries. So in withdrawal also can be treated very well in the rehabilitation center. And of course after that there should be de-addiction process. So now we are seeing a lot of different trends coming in addiction. Not only alcohol, we are getting cannabis like ganja addiction. It is rampant now in the colleges, and sometimes they are having thought problems, thought alienation. There are different thoughts. They are not talking clear cut about the these things. Sometimes they preach us. They sometimes they give us advice. So for such patient, what to do? How many days they should be admitted, and what should be the plans? I think the law and our government and we should have some guidelines for that, so that we can have proper de-addiction facilities and their protocols, their admission facilities. That all should be included, and we can take care of them properly. So addiction should be treated as a psychiatric condition, and they should be admitted under Mental Health Law 2017. Yes.
Yes. And also the elder people who are lonely, who are facing mental and physical problems.
Yes.
How do they actually access rehab and then come back to the mainstream?
Yes. Elder care also, a lot of problems are there now because dementia is on the rise. We can see the dementia by 2030, there will be overburden in India. A lot of people will be having this type of problems. So they are also delirious, confused, and they are not understanding their condition, the self care, they're bedridden sometimes, and falls, fractures, infection. These are the all problems when we treat the dementia patient. Sometimes the medication part is very less in olders, because even if they get violent, we cannot use much antipsychotic, because if we use antipsychotic, patient can get multiple side effects. So elder care requirement is also too much now, and we have to develop some facilities where they can be having safe, and their life should be comfortable. So that is also a need of our. So we have started three older cares, like Olive Elder Care. We have started three facilities in Bombay, and all Jagruti Center are also admitting the dementia and other things. Because these patients are also having sometimes we may require hospice type care also, like last stage of cancers, then last stage of any medical condition, post stroke treatment, post head injury, post hypoxic injury. So if we go into that, there are n number of conditions in which they require good care, good help, and treatment.
Yes, sir. I think that was a very comprehensive answer, and me and Saraswati are very happy to have this discussion on this very complex and also a very simple topic. So,
Yeah.
at the same time, there are a lot of conditions, there are laws, and there are societal attitudes around rehab. Also, there is a cost factor, which Saraswati discussed, and the kind of confusion people have that how will the society see you after you come out of the rehab? So thank you very much for your time. Saraswati, you would like to add uh, a few more points?
Uh, no, just want a last few words to our families. What about rehab centers, and what is it that they should, a message to them primarily, I would say.
Yeah, the most important thing for the families is there should be some meaningful life for this psychosis or schizophrenia or addiction patient. Sometimes otherwise their life is getting miserable. So if they are having good life, we also will have good life. So family members should consider, don't overburden yourself with the emotions. Sometimes they are overburdened. They are taking like 80-year-old female, old mother, and taking care of 50-year-old son who is getting violent, aggressive. Sometimes he can push, he can, and in that condition, they should understand that putting in rehab is not a punishment. Putting in a rehab is not a any violence, or we are not doing anything for the patient. That stigma should go down, and our target is to improve the life of the person. That should be the final statement for that.
So very well said, Dr. Shinde, that, I think lots of families still think that putting in a rehab is a punishment,
Understood. Mm.
and I think that message that, yes, rehab is a way of giving a meaningful life
Yeah.
to the person, giving him that identity back to him. And it's a process, it's a journey where the entire family is together, and it has to be looked at. The approach has to be changed, and the language has to be changed. So thank you so much for your time, Dr. Shinde, and I'm sure our families will benefit from this podcast with us. Thank you so much.
Thank you. Thank you very much for inviting me. Thank you.